Exemestane is an aromatase inhibitor used to treat breast cancer in postmenopausal women after treatment with tamoxifen. In this video, let's find found. What is exemestane? What is exemestane used for? Contraindication. What are the side effects of taking exemestane? How does exemestane work? How to use exemestane? What is exemestane? Exemestane, sold under the brand name Aromasin among others, is a medication used to treat breast cancer. It is a member of the class of antiestrogens known as aromatase inhibitors. Some breast cancers require estrogen to grow. Those cancers have estrogen receptors and are called ER-positive. Aromatase inhibitors block the synthesis of estrogen. This lowers the estrogen level and slows the growth of cancers. What is exemestane used for? For the treatment of advanced breast cancer in postmenopausal women whose disease has progressed following tamoxifen therapy. Contraindication. The drug is contraindicated in premenopausal women, which of course includes pregnant and lactating women. Side effects. The most common side effects, more than 10% of patients, are hot flashes and sweating, which are typical of estrogen deficiency as caused by exemestane, and also insomnia, headache, and joint pain. Nausea and fatigue are mainly observed in patients with advanced breast cancer. Pharmacodynamic. Aromatase is an enzyme that converts hormones to estrogen in the body's adrenal glands. The aromatase inhibitors, AIs, are drugs that reduce estrogen levels by blocking the action of aromatase in the adrenal glands. The selective AIs, SAIs, selectively reduce levels of estrogen without interfering with levels of other steroid hormones that are produced by the adrenal gland. Drugs in this class include anastrozole, arimidex, letrozole, Femara, and exemestane, Aromasin. Mechanism of action. Breast cancer cell growth may be estrogen-dependent. Aromatase, exemestane, is the principal enzyme that converts androgens to estrogens both in pre- and postmenopausal women. While the main source of estrogen, primarily estradiol, is the ovary in premenopausal women, the principal source of circulating estrogens in postmenopausal women is from conversion of adrenal and ovarian androgens, androstenedione and testosterone, to estrogens, estrone and estradiol, by the aromatase enzyme in peripheral tissues. Estrogen deprivation through aromatase inhibition is an effective and selective treatment for some postmenopausal patients with hormone-dependent breast cancer. Exemestane is an irreversible, steroidal aromatase inactivator, structurally related to the natural substrate androstenedione. It irreversibly binds to the active site, causing permanent inhibition necessitating de novo synthesis to restore epic function. Exemestane significantly lowers circulating estrogen concentrations in postmenopausal women, but has no detectable effect on the adrenal biosynthesis of corticosteroids or aldosterone. This reduction in serum and tumor concentrations of estrogen delays tumor growth and disease progression. Exemestane has no effect on other enzymes involved in the steroidogenic pathway up to a concentration at least 600 times higher than that inhibiting the aromatase enzyme. Half-life: 24 hours. Dose: breast cancer. Advanced disease. Indicated for treatment of advanced breast cancer in postmenopausal women whose disease has progressed following tamoxifen therapy. 25 mg POQ/day, continue until tumor progression. Adjuvant treatment. Indicated for adjuvant treatment of postmenopausal women with ER plus early breast cancer who have received 2 to 3 years of tamoxifen treatment and are switched to exemestane. 25 mg POQ/day. Continue until tumor progression. Breast cancer prevention, off-label. ASCO and NC guidelines suggest exemestane as an alternative to tamoxifen or raloxifene to prevent invasive breast cancer in high-risk women. 25 mg POQ/day for 5 years. Safety advice. Use is not recommended. According to some authorities, use is contraindicated. US FDA pregnancy category, not assigned. Risk summary: based on animal findings and its mechanism of action, this drug can cause fetal harm when administered to a pregnant woman. That's all the information about Exemestane we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.